when we invite Dr. Jeté to present as well. So does anyone have any questions for Dr. Hurdes? And you can do so either through the chat pod, or if you so choose, you can unmute your line individually at *7 and ask over the phone. There's one here. Do you have any data related to caregiver distress in epilepsy?
Yes, we do. So we have a paper that has been submitted to one of the BMC journals, so it'll be an open access journal if it gets published, that looked at caregiver distress across all the neurological conditions that we've identified here, and I'm pretty sure in my recollection that we had plenty of data for people with epilepsy in home care settings. And the general thing that you see is that diagnosis does matter in predicting caregiver distress, but when you add in functional measures like ADL impairment or cognitive impairment, behavioral impairment, those functional indicators are in fact more important than diagnosis alone.
Thank you. There's another question here. Why was the hospital population not included?
Because we don't yet have data for people in acute hospital settings. INTROI does have a new acute care assessment system that we're beginning to do research on in acute hospital settings, but we don't have data on the general population. We do have data for ALC patients in hospitals that have been assessed with the IHC, but not the general hospital population.
Excellent. Does anyone else have any other questions for Dr. Hurdes? Okay, well, we're going to move right along then. I want to say, first of all, thank you, Dr. Hurdes, for taking the time out. I know